Hello, everyone. Welcome back to another episode of Doctors Go Live with me here, Nina Sharil Khan, your host for Doctors Go Live. And today we are talking about coughs beyond the common cold. Now, let us know if you're tuning in, where you're tuning in from, and do share with us if you've how you've been and what you would love to learn in today's episode of coughs beyond the common cold. And if you share this video out as usual, you get to take part in our Doctors Go Live quiz happening right at the end of the Q&A, at the end of the episode, where we've got some towels for you guys to win. All right. Now, all this is happening right here in Doctors Go Live with me, Nina, and our special guest for today, consultant emergency physician from Columbia Asia Hospital, Bukit Rimau, Dr. Nabeela Azmi. Okay. Now, what are we talking about today? Coughs, which can sometimes be more than a symptom of the common flu. In fact, in today's episode, we're going to peel back the layers of the common symptoms to reveal the hidden complexities. So, today we are uncovering the possible impact of coughs on your well-being. All right. So, also we're going to be sharing some practical strategies on how to manage coughs. All right. So, if you know somebody who's going to benefit from today's episode or who's going to find it super useful, please make sure to share this video out, tag them, because you never know who you're going to make a difference to. All right, sounds good? Tag away. All right. Now, while you're tagging away, do take a look at this video.
Coughs, frequently brushed off as a typical sign of the common cold, may sometimes signify hidden health issues. Join me, Dr. Nabeela Azmi, consultant emergency physician from Columbia Asia Hospital, Bukit Rimau, in the next episode of Doctors Go Live, where we'll dive deep into these often underestimated symptoms and provide you in the practical solutions to manage coughs effectively. Happening on Wednesday, 15 November at 3 p.m. See you!
All right. Welcome back, everyone. Welcome back to another episode of Doctors Go Live, where today, if you've just joined, we are zooming into coughs frequently brushed off as typical signs of common colds. Thank you so much for joining us. Jacqueline, big shout out to you. And here to help us shed some light on how coughs can sometimes be more than hidden health issues, please welcome consultant emergency physician, Dr. Nabeela Azmi from Columbia Asia Hospital, Bukit Rimau. Welcome,
Hi,
Doc. How are you doing?
I'm good, thank you.
All right. Thank you so much for joining us. All right. Now, before we begin, to our guests who's tuning in today, as with every episode, right at the end of the show, we have our Doctors Go Live quiz, where today we've got some towels up for grabs. So be sure to pay attention to Dr. Nabeela, because you never know, you could be the winner. All right. And most importantly, if you have any questions, feel free to ask your questions right in the comment at any time. And right at the end of the episode, we'll bring them all up to answer all those questions. All right. Sounds good? If it sounds good, let us know in the comment section. All right, Dr. Nabeela, we're very excited to have you here today. But before we begin, could you share with us a little bit about yourself? What is it that you do? And how did you get started in medicine, and why emergency physician? In fact, what is an emergency physician? I think not all of us know what exactly that is. Yeah. So over to you, Doc.
Hi, my name is Dr. Nabeela. I'm a consultant emergency physician. So not many people know what emergency physicians are, because compared to the other specialties like pediatrics and internal medicine, emergency specialist or emergency physician is a relatively new subspecialty. So what we do is, because I think maybe in the late 1980s or early 1990s, the role of emergency departments around the world has increased. It's because of the fact that more people really sought help from emergency department, because they come with undifferentiated disease. This also lies on the fact that sometimes in a country, depending, as well as Malaysia, our family medicine, our general practice, sometimes we don't really have a situation where everybody has a doctor, a family doctor that they're assigned to. So some people straight away goes to emergency department, and then emergency department will end up with a backlog of cases, and some of them are quite complicated. And so it's the role of emergency physician to sort of like be the leader among all of the doctors to make sure that all of the patients have been seen, diagnosed, given proper treatment, and also whether to be admitted or to be discharged. So those are the roles of emergency physician. Basically, we will sort out all the undifferentiated diseases and then make sure that they are being treated. Yep.
Oh wow, I did not know that. Did you guys know this? Let us know in the comment. So
Yeah.
the emergency physician, yeah, doc, are they're basically with the emergency department? Is that what happens?
Yes, emergency department. So what happened is, let's say somebody comes with tummy ache. Okay, so I wanted to say about cough, but then later we'll be talking about that. Let's say it's a tummy ache. Okay. So people can have tummy aches for a lot of reasons. So it could be just food poisoning, in which the doctor might only need to refer. If it's the patient is dehydrated, or it could be something as life-threatening as an ectopic pregnancy, or it could be something that could be a ruptured blood vessel within the stomach, or even maybe ischemia of the bowels. So those are the things that what emergency physician does. So basically, we go through the cases and then we differentiate, and then we find out, okay, this is the kind of patients that can be discharged with medications, with or without a follow-up, or these are the kind of patients that needs to have more workup, for example, admission to do a CT scan, or admission to do a urine test to make sure that they don't have renal calculus and things like that. So yeah, so
So
differentiating is
yeah.
also one of my specialties. So therefore, I choose this topic today.
Okay, no wonder. Okay. So in your experience here, doc, do you get a lot of cases with coughs? And why is it important that we talk about today's topic, doc?
Okay.
What do you want everyone to take home?
Yeah, I can safely say that probably 25% or up to 30% of my cases is something along the lines of coughs or runny nose or fever, because especially so after COVID, because people are more aware, and then we in my hospital, Columbia Asia Bukit Rimau, we also cater for a lot of pediatric cases. So around 30% of my emergency department are pediatric cases. So these kids, they go to school and their immunity is not as great as adults. So they will come in with runny nose and coughs and things like that. Yes, so I do come see a lot of coughs every day.
Wow. So 30%. Yeah. And what do you want people who are tuning in right now to take home or to be your messengers to other people? What would
Yeah,
you like
that
them to
would be
know?
great. Yeah, yeah,
Okay.
because
We have, go
Mhm.
on. Sorry.
Yeah, so to a certain extent, coughs can be treated at home. You just need a lot of rest and things like that. But there are telltale signs that may signal you to come to the emergency department or get yourself checked to any doctors, so that the doctor can find out what are the cause of it, instead of just drinking the over-the-counter cough medicines without really finding out the reason why you've been coughing for a while now. Yeah.
Okay, got
So.
it. Just one more question. This might be a bit personal, but how
Mhm.
did you get into emergency? How did you ended up as an emergency physician? Did
So,
you always knew all along that's what you wanted to
no,
be?
no, actually, as I was doing my medical training, I thought I wanted to be an internal medicine doctor. And then because at the university that I was studying emergency medicine, I was studying in Ireland. Emergency medicine wasn't that great, wasn't that big, because of the fact that they have a very strong general practice kind of system. But when I came back to Malaysia, I did my posting in emergency medicine. I fell in love with it, and thankfully, right after my housemanship, I was given an opportunity to work in a tertiary hospital emergency department, and subsequently, I managed to get into the master's program. Yeah, so that's how I
Wow.
ended up.
So
Yeah,
that's how you ended up, and no regrets, yeah?
yeah, no regrets at all. Yeah.
For our audience at home, she's definitely the person we should be listening to today. All right, so let's get started. Okay, so let's get straight into this here, Doc. So, what will we be covering in today's episode? If we can have the slides up, yeah.
Okay, so today I'm just gonna talk about what is cough actually. Sometimes people say that cuan, sesak nafas. They say nak tarik nafas tak boleh, but actually what they have is like difficulty breathing because of cough. And why do people cough? And why I say when I want to talk about why people cough, I can't avoid but to talk about the diseases itself. So I'm going to talk about the various conditions that can cause coughs. And
Mhm.
finally, just the last few slides is when to seek treatment and how can we tackle the problems of cough.
Okay, got it. All right, so let's go straight to the basic then. What is a cough? Yeah, doc, so that we all
Yeah.
are aware.
Okay, so what is cough actually? It's a protective mechanism, and the aim is to clear out our airways. So it's actually a coordinated series of movements. The way it is we will take a deep breath, and then we our glottis, one of the coverings to differentiate between our air passage and the food passage, will close, and then we have a forceful expiration or forceful letting out of air to clear out the airway secretions. So this protective mechanism is very very useful, and in fact, if especially in the pediatric age group, for those under 2 years old, doctors are actually not encouraged to give cough medicine because the usual cough medicine is actually to suppress cough. So there'll be more harm to suppress those cough because it's a protective mechanism. So usually we will let it be, but the role of the doctor is to find the cause of it. Is it because a lot of discharge, postnasal discharge? Is it because of allergies and things like that? So not the idea is it is a protective mechanism, and you can't. If it's like really just a cold, then giving cough suppressants are fine, but we really should get to the bottom of it rather than just giving cough suppressants, especially in the pediatric or children population less than 2 year olds.
All right, got it. So
Okay.
then, doc, if that's the case, let's get to the bottom of it then. Why do people cough?
Okay, so the most common reason that people cough is actually infection. So infection can be from the nose, can be from the throat, can be from the back passage or our pharynx. It could be your bronchus, or it can even go all the way down to the lungs. And then it can also be because of a heart, kidney, or liver conditions. I'll go through it later. And we can
Mhm.
also have it from nasal drip. So what happened is some people, they kind of live through this situation where they have a lot of, like they will be like that all the way in the morning, and they'll get better. But and then they have what happened actually is there are a lot of postnasal drip, means there's drips at the back of their nose. So this nose can be these drips can become irritants and cause them to cough. So sometimes this can also be uh, recall or called named by Malaysians as resdung and things like that lah, and sinusitis and cause of that.
Mhm.
So allergies can also cause cough. So what happens is somebody has more tendency to develop allergies than another person. So they go into a place, a new place, or maybe somewhere dusty, then they'll cough, or they go into a pet shop, or they play with some cats or dogs, and then they have this cough. Irritants as well. So these irritants includes what relevant to us Malaysians a few weeks back was the haze. So some people can have exacerbation of their asthma, or they could be coughing. And then another thing is gastroesophageal reflux. We'll go through that, which is actually an abdominal problem. So this can also cause cough. Smoking as well, and then also side effects of medications. We'll go through all of that later.
All right, and it's important to know what causes this, right, doc? Why? Yeah.
Yeah, because you don't want to be, continuously suffering, one thing, or another thing, continuously taking medicine over the counter. Because some of this medication, of course, if you take them within the dosage, the side effects are really low, but it will still cause you probably drowsiness, probably a lot of sugar, and then taking away your productivity. Yeah,
Mm,
so it's
okay.
very important. Mm.
All right, got it. And I thought it was just a cold thing, but it looks like there's so many. So thank you,
It
doc.
is, yeah,
Right.
mostly, but it can also be other things.
Yes. Okay. So let's go straight into it. Then the first one is your cough could be because of an infection. If you
Mhm.
could share with us, doc.
Okay, so the most common one is upper respiratory tract infection. So our respiratory tract starts from our nose, our mouth, goes all the way down to our throat, and then finally our bronchus and lungs. So when I say upper respiratory tract infection, it's actually the upper part. Okay, so it's quite common. So it can be uh, there's also associated with postnasal drips, rhinitis, and sinusitis. So rhinitis is a tendency for people to develop sneezing and also maybe a bit of runny nose whenever they have any reaction to dust or pets or some food and things like that. And sinusitis is when they have infection of their sinus. So these are all the diseases that are associated with upper respiratory tract infection. We also can have like influenza-like illnesses. So, for example, like influenza and COVID. So we went through COVID before, and then COVID as an entity, it is something that can be asymptomatic, or you can have things like coughing, headache, and also fever. Um, but if you have influenza-like illness, generally it's more severe than the previous condition. A patient might have fever more than 38 degrees. So when somebody has fever, they will look really lousy. They will really look really lethargic. So that's when we call that they're having malaise, headache, and myalgia. So another thing is cough and sore throat. So for influenza-like illness, if you're able to eat and drink to keep yourself hydrated, and you're able to take your medicine, especially in the age group, for example, like 18 to the late 20s or early 30s, you can probably get by with over-the-counters medication. But if you feel that there's something, you can't get out of bed, you're not able to drink that 8 cups per day, it's better to get yourself checked. And how do you get yourself checked? Is by getting swabs, done. And sometimes, by getting the swabs done, we have detected the influenza virus. The doctor may be able to offer you Tamiflu or anti-influenza medication. So what will happen is you will get better faster. So yeah, so that's influenza-like illness. Otherwise, drink a lot of water. But if you can't drink a lot of water, other things that we can offer as a doctor is also to increase your hydration by giving you intravenous hydration.
Hmm. Okay, that
Okay.
sounds, yeah, okay. Got it. Again, it's quite shocking actually. All
Yeah.
right.
Yeah.
What about pneumonia here, doc? How does it cause cough? What
Okay,
is
so
pneumonia?
pneumonia is a bit more severe than in a sense that it actually affects your lung parenchyma. So you can see from that picture of that X-ray, okay, and from that image of somebody coughing, it says normal air sacs, and then there's inflamed air sacs. So what happens? These are the air sacs that helps you to exchange oxygen. So you breathe in oxygen, and then the oxygen will be absorbed by your blood, and then the oxygen will be delivered to the rest of your body with the help of your heart. So what happened is parts of your lungs are being infected, so that your efficiency to get oxygen around your body is reduced. So your oxygen is reduced, you feel very tired, and then you may not be able to eat and drink. So it can be caused by bacteria, viruses, and even fungus. But fungus is more like somebody who is immunosuppressed and things like that. There are many ways that you can classify pneumonia, because, to be honest, the treatment varies with each classification. A simple one is called a community acquired pneumonia. And strictly speaking, actually, a community acquired pneumonia, provided that the patient is not dehydrated and their oxygen is fine, it's still acceptable for the patient to be receiving treatment at home. Okay, so even though it's a lung infection, you can be treated at home with antibiotics. But if
Okay.
it's a hospital-acquired pneumonia, for example, a hospital-acquired pneumonia, the realm, the possibility that the disease is multi-drug resistant is higher. So the kind of antibiotics or the kind of treatment that you need will be different. And usually these are strong antibiotics. They are not available in the oral form. And to be honest, usually if you have hospital-acquired pneumonia, you'll be so ill that most probably you'll not be able to tolerate the oral medication. You'll be so tired, or you'll be having things like vomiting and poor appetite that you won't be able. So you have to be admitted. So other things are maybe called anatomical classification. For example, lobar or bronchopneumonia, depending on the chest X-ray finding. So why we classify it as that? Because certain organism requiring certain antibiotics causes lobar pneumonia, and certain organism causing a more widespread infection has a different organism requiring a different type of antibiotics or treatment. And then also typical and atypical. Typical pneumonia basically means that the bacteria is a common one, and then the patient usually presents with the usual fever, cough, difficulty breathing. But atypical pneumonia, Sometimes the patient might have fever but does not have that really bad cough, and it's possibly exposure to bacteria that are not common. So these people might have history of going hiking or jungle trekking or swimming in lakes or rivers. So these patients are the kind of patients that might require a different types of antibiotics. So it causes difficulty of breathing because it affects the part of organs that involve gas exchange. To diagnose it, you need a chest X-ray, and sometimes the doctor might send your blood not only to check for the normal white cell count markers. We might also send your blood and sputum for culture. So what that means is sending your blood and trying to grow any bacteria or any virus if there is any, and then to see what kind of antibiotics responds to it. And then we might also do a CT scan if an X-ray is not enough. And then sometimes if it's really really bad, a specialist might also require you to do a bronchoscopy. Basically, a bronchoscopy is something. Oscopy basically means it's a camera test, but along with the camera test, what the doctor can do is they can do some suctioning. So, for example, there might be some mucus plugs at your bronchus that that once it's removed, it can actually improve your breathing. So, I'm talking about patients who are severely ill that they are on ventilators or life support. Okay, and then
Okay.
yeah. So and another thing, you can also if somebody has chest x-ray findings and they have this cough, there's a possibility that it could be pneumonia, but at the back of it we're always thinking about other things like cancer. So lung cancer is one of the most common cancer as well. So bronchoscopy can also be done. So treatment for pneumonia is actually antibiotics, oxygen, nebulizers, and hydration.
Wow. And all this is just pneumonia, right?
Pneumonia, because it varies from a very simple pneumonia to a very very complicated one. So and
Wow.
in fact pneumonia is one of the top reasons of death in Malaysia.
Wow.
Some
Okay.
yeah so yeah so the top is actually cardiovascular diseases, so things like heart
Mm-hmm.
attacks and that, and then followed closely by pneumonia. Because at the end of your usually if somebody make it to the golden age, more than 70s, what happened is their immunity will go lower, and then they will get an infection, and that's how they die. So you can, of course, sometimes if somebody lives at home, then usually the cause of death, sometimes the police will just say sakit tua, but actually invariably it's possibly pneumonia with dehydration and things like that. So it really
Wow.
is quite yeah.
Okay, so number two cause of death, yeah. That
Mhm.
is an eye opener. I did not expect that. So other
Mhm.
causes of coughs could be asthma as well, doc?
Yes, so asthma is a chronic entity. So when I ask my friends who are non-doctors, when I say chronic, what I meant is a long-term thing. But
Mm.
sometimes people mistook chronic as bad, so
Yeah,
that's not what I
serious.
mean.
Yeah.
You can have a well-controlled asthma, but asthma is a long-term thing, which is a chronic thing. It's because of hypersensitivity. So all these hypersensitivities has a genetic predisposition to it. So whenever if it's a 1 year old or 2 year old, we don't usually diagnose somebody with asthma. But as they grow up and they have this kind of thing where they every few weeks or every few months they'll be coming with wheezing and difficulty breathing, and there's no fever with it, and it's precipitated with things like playing with cats or exposure to cold or certain food. So
Hmm.
that is asthma. So, what are the symptoms? It's actually cough, wheezing, chest tightness, and shortness of breath. And if you can see the picture that I have on of the airways, okay, so you look at the left side, it's a normal airway, and if somebody has asthma, their airway is actually a bit thicker and it's a bit narrower. So what happens is it takes a lot of effort for them to breathe in, and when they're having an attack, the airway becomes even narrower. So what happened is they will be wheezing and they will have difficulty breathing because they're trying very, very hard to take the air in, also to take the air out.
Hmm.
Yeah, so what they need is actually inhalers and nebulizers. And recently, actually not really recent, the past few years, the past 10 years, we have been advocating people to be on a daily kind of inhalers. So these inhalers has low dose steroids, okay, in which we stop them from overreacting to the daily irritants, because if we don't, then what will happen is their airway will get narrower and narrower. So when they have an attack, it comes from like an already narrowed airway to a super narrowed airway. So it's very very important for somebody who has a previous for somebody who has frequent asthma attack to be in touch with a respiratory specialist to get a treatment. Okay, so in these pictures, there's a picture of a boy on home nebulizer,
Mm-hmm.
but actually equally good is an aero chamber. So an aero chamber, if you can see at the tip, where the little girl is holding is the inhaler. So I think a
Mm-hmm.
lot of people are familiar with the inhaler, but maybe
Yes.
not as many is familiar with the aero chamber. So I think at the start of the aero chamber, people are advocating pediatric, meaning the kids and also the elderly, to be using aero chamber. But actually, the use of aero chamber, even if you think that you can use an inhaler, it increase the probability of the medication going through your lungs rather than going through your stomach. Because you see, if you use an inhaler, you press it and very quickly you have to take a deep breath, and it's part of the medication is going to go through your stomach instead of going to go through your lungs, even with a very very good technique. So if you know how to use an inhaler, probably you can avoid needing the nebulizer. Although I think because the advancement of Shopee and people can just buy nebulizer machines, people like to use nebulizer. But the problem is if they're too dependent on the nebulizer, let's say if they're traveling and stuff, they don't know how to use an inhaler or air chamber. So
Mm-hmm.
I would really suggest people who are needing inhaler to get yourself your own aero chamber. So that way, you'll be familiar with it, you're familiar with the technique, and you won't be as dependent to use the nebulizers, because the medication is actually the same. It's the method of delivery that is different.
Okay,
Okay,
got it.
that's yep.
Okay, so how big is asthma a problem for Malaysians? Just wondering, out of curiosity.
Okay, so if it's quite a big problem in a sense that we have this public understanding of asthma as something that is bad, and then that the inhaler is a bad thing, that you'll be dependent on it.
Mm-hmm.
uh, it is true that you're dependent on it. It's the same way as if you don't take your high blood pressure medication. If you don't take it, you are going to have that side effect of a poorly controlled asthma. And then within my acquaintance, I've already known a few people that actually pass away because of a very acute asthma attack, something called status asthmaticus, which is something that is not supposed to be happening. If somebody has a well controlled asthma, then they can avoid the narrowing of the long term chronic narrowing of that their airway. And these are people that are very very young. So I think people need to go past the misconception that taking inhaler is a bad thing. Taking inhaler causes dependence, and taking inhaler causes your body to be weaker. That's what I feel when I speak to my patients. They feel like macam nanti nanti saya dependent kan, once saya dah stop, saya dah start, saya tak boleh stop kan doktor. So that's actually a wrong understanding, because the idea is you want to avoid the attack, because when the attack happens, it could be life threatening.
So, what
Yeah.
should be the right understanding since we've got everybody tuning in? How should they be viewing it instead?
It should be viewed as uh, a condition that can be controlled if you take your medication well. And the aim is for you to avoid an exacerbation.
Mm-hmm.
Okay, how do you
Okay.
know that? How does a doctors know that you have too frequent exacerbation? So basically, in asthma, you have there are a few types of inhalers. Okay, so they are the preventer and they are the rescuer. So if somebody is using a lot of the rescuer, I think if most people call it Ventolin, it's the blue colored inhaler. If somebody uses their canister, finish it very fast, for example, 1 month sudah habis or 2 weeks sudah habis, you know that they are using a lot of uh, rescuer. So that's not a well-controlled asthma. If they wake up at night a lot of times, if they are missing out on school or work a lot of times, so that's how we know. That's how the doctor judged that you are having a poorly controlled asthma. So somebody with a well-controlled asthma will have very few exacerbations, less than two a year, and they wouldn't be needing their rescuer. So how do you avoid having an exacerbation? You have to use your preventer daily, and this preventer is actually a very low dose, sort of low dose steroid, inhaled steroid that only exposes your body. The airway that needs it. So the contrast is, if you are having an exacerbation, the doctor have to give you oral or even intravenous steroids, which is even worse. Okay, because steroids has its uses, it has its benefits. If you need it, you need it. If severe allergy, you need it, you need it. And the idea is for you to just be on a tiny low dose steroids, so that your body doesn't have this frequent exacerbation and continue to become thicker on the sides, narrower at the center, so that to avoid a very bad repercussion, a very bad exacerbation.
So if I'm
Yeah.
hearing this correctly, in the long term, if you don't take it,
Mhm.
your thingy becomes thicker, is it?
Yeah,
So
yeah, your airway will become
yeah,
narrower because the
I'll
sides,
narrow it.
yeah, it becomes narrower.
Okay,
Yeah,
got it. So it's prevention is better than cure lah.
yeah, yeah,
Definitely.
yeah,
Okay, sounds
yeah,
good. All right.
yeah.
So next, I see some questions with respect to asthma. Keep them coming because we're gonna answer them at the end. Yeah. So let's talk about COPD, chronic
Oh,
obstructive pulmonary disease. What is this?
okay.
Lamanya, panjang.
Sangat panjang. So I'm just gonna say it as COPD. So there are two types of COPD. One is chronic
Mhm.
bronchitis, another is emphysema. Not really important for us to differentiate between the two in terms of this talk lah. Okay. When somebody comes with COPD, usually they're a bit older. Okay, and they have this. The most common one is smoking history, a very significant smoking history, or quite rarely is sometimes they have exposure to chemicals, or usually chemicals when they are working when they are younger. So they could be like a painter, they could be like a chemist, they could be a welder. Okay, and the symptoms are quite similar to asthma. So even the chest findings, which means what I hear when I listen to their lungs, are similar to those who are having exacerbation of asthma, but the cause is a bit different. And usually, people with chronic obstructive pulmonary disease, they tend to have fever along with it, and they have thicker phlegm, okay, because of emphysema and things like that. So in the picture is somebody carrying along with him an oxygen tank. So that could be somebody who is living with COPD. Could also be somebody with lung cancer. I'm so sorry. Most of the pictures when I Google kan, semuanya gambar non-Asian tau. So it's not like I put Asian sangat. But it's all the pictures are, like gambar orang putih.
Asalkan we understand, yeah.
Yeah, yeah, yeah. Sorry about that. Okay. But we do have people going around in Malaysia with oxygen tanks as well. And this could be because of COPD. So what happened was a lot of their lung parenchyma, or the small cells, have already been destructed. And they kind of, over the years, they have learned to live in a situation where their oxygen can be as low as 88%. So whereas you and I, we cannot, even if our oxygen is 96%, we'll be very very uncomfortable. We'll be coughing. We'll be basically, hungry for air. But these are the kind of patients, because the problems happens over a period of time. They have learned to live with it, but of course the doctor will usually prescribe an oxygen saturation between 88 to 92% because of a long-term thing. So over the years, they learn to live in a lower oxygen situation level, but they will also have exacerbation, some sort like asthma. So for example, if they have fever for something else, and then they have a higher tendency to develop pneumonia. So the difference for the management, for the doctors, is we have a lower threshold to treat them with antibiotics and to admit them, compared to asthma. because asthma usually it is because of allergies and things like that. It
Mhm.
depends. If the temperature is really high and the white cell count shows that there are a lot of bacteria, we will start antibiotics. But in contrast to chronic obstructive pulmonary disease, we will start antibiotic a lot sooner compared to asthma. Yeah.
Got it. Okay.
Okay.
So let's take a look at the next one, which is, oh, smoke. Yeah.
Yeah, so actually these pictures are the etiology or the causes of people having COPD. So, okay, let's
Mhm.
look at the picture of somebody holding that cigarette. Okay, so this cigarette causes so many negative impacts to our health. So not only it causes COPD, it also causes heart disease. So heart disease also can in the end, if you have heart failure, causes cough. Also, it can also 90% of lung cancers are actually from smoking. So I really don't I can't brain why people are still smoking, because as you bought the cigarette, the pictures are all there. In medicine, it's very difficult for you to prove something is and to prove something is not. But cigarette smoking is one of the things that, okay, we can easily confirm that is bad for your health. So if you smoking, and even secondhand smoking. So in fact, I was listening to a recent talk by a fellow oncologist.
Mhm.
Even secondhand smoking, uh, they have found out that actually secondhand smoking is kind of worse than first-hand smoking. But the only thing is, if you're first-hand smoking, then you're repeatedly exposing yourself, so the frequency is higher. But if you happen to be the partner of somebody who smokes, and whenever they smoke that you are there, um, it's actually even worse for you. So smoking is really bad. So you can also develop COPD from smoking, heart disease, lung cancer, um, a lot of other things. Okay, and then the other pictures are people, people working with chemicals, people exposed to dust. So it's very important for if you ever work in this kind of situation, to have a very good OSHA or OSHI in your company, to ensure that you actually are protected adequately when you are working.
Okay.
Okay.
Got it. So these are possible causes of COPD. What about a whooping cough? I've always
Okay.
heard this, but I never quite know why it's called a whooping cough. Or
Okay.
what is it actually? Yeah.
I initially in the first slide presentation that I prepared, I didn't include this, but then I remember in August we kind of have like small outbreaks of whooping cough in Malaysia. So it's actually caused by the bacteria pertussis, and it's it can be prevented by vaccination. It is. Yeah, it can be treated with antibiotic, but because of there are some anti-vaxxers and things like that. So there have been outbreaks in Pahang and even in Klang Valley back in August. So why it's called a whooping cough? Because it sounds exactly like that. So if maybe somebody can play the video of the nasty
Video.
cough, you can see what is called a whooping cough.
Okay. Can we have the
Okay.
video?
Yeah.
How do you manage croup?
Okay. Okay, actually, the video is of the child before that. Okay, unfortunately, that's another picture. Okay, that's another video of croup. Okay, this child,
So that was a croup, is it?
that was a croup, not a whooping cough. Okay, a whooping
Okay.
cough is like a intermittent cough on top of each other, and finally you're almost like you wanted to vomit yourself out. And then it has said that when before the advent of vaccination, kids would actually break their ribs, from coughing.
Oh my
It's that bad.
goodness.
Yeah,
It's that bad, huh?
it is really that bad. But thankfully, with vaccination, the thing about vaccination is sometimes you might have, but you might still contract pertussis, but because of the vaccination, you won't suffer from it as
Wait, it's
bad.
bad.
It's not as
Yeah.
infectious. The same way why when we're taking our COVID vaccination, right? I think our COVID
Mm.
vaccination basically proves the rest of us why vaccination works, lah. Okay, because
Yeah.
people took for granted that we have always been receiving this pertussis vaccination, and people didn't see it, so people didn't take it, people didn't send their kids for vaccination, so that's why the outbreak happened. But I hope we managed to tackle that. Of course it's treatable, but to prevent is better. Yeah.
Right. So I think that's what we need to understand, that taking
Mhm.
vaccine, it's not to make you invisible from the
Yeah.
pain, from the disease, but it's actually to protect you so that when it hits you, you don't suffer, you don't die from it.
Yeah.
Right? Yeah. To put it simply. Okay. So that is a whooping cough
Yeah.
and the croup, right? Anything
Yeah.
else you want to add to this?
Yeah, I'll just talk about croup. So croup is something that happens more so towards the younger population, pediatric. So it's actually inflammation of your upper airways, your larynxes, and then it's characterized by a barking cough. So this croup sometimes might be missed. So I really appreciate it if the parents of my patients, came in with a video or some doctor, this is how my kids cough at night, it's really really bad, and then I can hear it, because with the thing with infection, especially croup and cough, sometimes it's worse at night, at 3 a.m. and things like that, and then the mom was just holding on through the night, and then pukul 8 bawa, and by the time pukul 8 the child is a lot better and not coughing in front of me, so I might miss the diagnosis. It's a barking cough, and it's usually by virus, and if it's really bad, the child can be admitted. And what we'll admit is we're going to give the nebulizers, but the type of medication is slightly different from what we're given for asthma. But in fact, if you have what the child need is actually steam, okay, warm steam. So kalau you boleh letak air panas and let the child breathe it, is okay. Or even if you have, like, some people dah memang ada nebulizer kat rumah and they ask me to give that medication, and I say no, 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 all you need to put is actually normal saline. A nice steam will actually improve the condition. But of course, there's always a range of complexity. So if it's really bad, the child might need to be admitted, and we'll give you nebulizers with steroid or a medication called adrenaline. And if you can turn on the croup sound for me,
Okay. Can
please.
we have the croup sound again?
Mm. Okay,
So that's
so
what it
that's the
sounds
group sound. Yeah, that's how it sounds. It's a barking cough. Yep.
like. Okay. Sounds
Mm.
kesian sangat because it's a baby
Yes,
kan? Yeah.
sangat-sangat kesian.
Itulah.
Because masa tu nampak macam dia tak cukup nafas. They will look
Oh,
like that.
oh,
And
poor
they look
thing.
like blue lah. Look like blue.
Okay. So what about these ones, heart, kidney, and liver conditions? How do they cause coughs as well?
Okay, so if somebody has heart failure or kidney failure and actually liver failure, so what happened is the heart pumps the blood, and the kidney filtrates our blood, and the liver also to a certain extent. Um, what will happen that the patient will have fluid overload. So what happen is there'll be a backlog of fluids that will end up in the lung. So this can present as a pulmonary edema or an effusion, which may cause difficulty breathing and also cough. So that's how a heart, kidney, and liver condition. So usually the person might look edematous, so they might look swollen, and they will have swollen hands and feet and even tummy. So usually the first things that will be affected are your legs. Okay, we'll check the level of the edema. Is it just until your ankles? Is it up to your shin? Is it up to your thighs? And when it get worse, it actually go up to your tummy and even the back. So a doctor will then press and then find out, okay, is that because of that? And then we'll do a series of tests. For example, an ECG, an X-ray, an ultrasound. We'll take some bloods to check to diagnose this condition. So that's how they can cause coughs. So these are pictures of X-rays just to show that the normal X-rays on the left side and the middle and also the rightmost are pictures of somebody having fluid overload and effusions. So because of the way that the effusions or the fluids affects the lungs, so it causes irritants, and in turn the symptoms that the patient will present with is with cough and difficulty breathing.
Okay, got it. So
Mhm.
these are that. And what about gastroesophageal reflux?
Okay, so this tends to happen not really in the young. Also it can happen if you can have stomach acid refluxing or going back flows back up because your sphincters are not working. So when it goes up, technically it still goes within your esophagus, but it's quite irritating. It's considered an irritant, and then the way the body reacts is you cough. Okay, in the worst case scenario, the reflux go all the way up and even might go into your air passage or your trachea. So this might cause an aspiration. So to avoid an aspiration, your body will try to ensure that this didn't happen. They'll cough, cough, cough. So that is another example of how the cough is a protective mechanism, basically trying to avoid this acidic material or the food content to go through your airways and going all the way down to your lung and causes pneumonitis or chemical infection. Yeah, so that's
So
how.
how do you treat coughs like that?
Okay, so this is the reason why some of a history and examination is important. Sometimes people have this ongoing cough, and they also have this kind of like a refluxing. They will say like, okay, after I eat a huge meal, then I have this like brash or like a sour taste in my throat, and then I have this cough. So how do you treat that? Is to
Mhm.
actually diet modification, and the way you eat. Don't take large meals, and then to take meals, not to take late meals as well. And then smoking also worsens it. And then there are medication that can help. There are medication that can help with regards to increasing your rate of emptying your stomach. So the food goes down a lot faster, and your symptoms will improve. Yeah.
Okay, so basically this one is a diet one because again we go back to the cause of the cough.
Yeah. Yep. Yep.
Okay, got it. And this one I believe is the last one on why we cough.
Okay, so one of the biggest problems in Malaysians is actually non-communicable disease. So non-communicable disease maksudnya disease yang you sendiri carilah, sendiri terjadilah. Contohnya diabetes and hypertension. It's non-communicable. It's not
Okay.
it's not infectious. It's not because I hang out with you or hang out with you. Okay, non-communicable. It's high blood pressure and diabetes. It's the number one cause of heart disease, kidney failures, and things like that. Okay, and this medication that ended with real, okay, enalapril, perindopril is one of the best way to the best antihypertension or high blood pressure medication there is. It's good in a sense that it improves your heart contractility and it also improves your kidney functions a bit. Unfortunately, nothing is without side effects. Okay, in this world, nothing. Even if you eat, even if you drive, even if you cross that road or use this pen, there's always some risk to it. And the risk of taking this antihypertensive medication is actually developing like a chronic cough, chronic dry cough. So if you have a cough, especially in the elderly, and they've just started the medication, it can also happen after a few months they're on it. I will take their medication history. So I will take their medication history, and if I see that they have this, then I will probably advise them to change it to a different agent. So this is one of the common side effects of this antihypertensive medication. Although it's a very good one, unfortunately, quite a number of patients develop a reaction in terms of developing cough. Yeah.
How long do they go before these coughs develop, especially if they're on these medications, aga-aga,
Okay.
and what
So
dosage?
some people within the first week they would have had it, but there are cases that initially they don't, but after the third month or after the fourth month, then they will develop. But the way for a doctor to diagnose, it's not really sci-fi. There isn't really like uh, a blood test that can say, okay, you cannot take this. What the doctor can do is to stop and see whether it stops. So in the
Okay.
Yeah. So in the meantime, how we manage the blood pressure is to change with a different agent, a different mechanism to bring down the blood pressure and not this medication.
Of course,
Yeah.
diet will be the best solution, right?
Yeah, diet is the best solution, but
Mm, not
it's the
everyone.
best. Oh yeah, it's not for
Mm.
everyone, I guess.
Okay.
Mm. Yeah.
Okay. So that's like so many reasons why people cough, right?
Yeah.
How do you
Mm-hmm.
eliminate or figure out which is which, especially in an emergency situation? Out of
Okay.
curiosity.
Okay, so when I first started when I went to medical school, then there's this like really old thick book that says 90% of the diagnosis is from history and examination, and it is exactly true. So what I need to do in an emergency department is to take a, a thorough history, maybe a thorough but targeted history. Okay, so if it's a young patient, then the story is a bit short lah. Okay, you're having a fever, you have this postnasal drip, you have a tendency to develop rhinitis, and I can say, okay, this you have a bit of sore throat, then this is this, and I'll go, check for COVID, check influenza. If the lungs doesn't have any funny noise, I probably wouldn't do an X-ray. If there are funny noise, I might do an X-ray and things like that. So it depends. So 90% of it is from history and examination, but to diagnose it, I can do swabs, I can take bloods, I can do an X-ray, I can take blood culture. I can also do like a trial and error thing. For example, stopping this medication, and then, for example, if somebody is with asthma, then I can say, okay, you have to get rid of the carpets in your house and then try this medication for a while and things like that. So that's how I diagnose it. Is that
Okay, got
okay,
it.
or you hoping for something else?
Oh no, no,
it's
no, no.
it's
Just
really
curious.
boring like that, yeah. Yeah.
Some is very similar again, so but
Yeah.
it's true, because I think it's true examination, looking at what
Mhm.
medications and what their history is, and examination as well is the
Yeah.
best, right?
Yeah.
And elimination of the medications to
Mhm.
see which is which. Okay.
Mhm.
All right, now I guess comes to the biggest question. Yeah, I have a cough.
Yeah.
When do I seek treatment, or when do I stay with over the counter cough remedies? What's your advice?
Okay, my advice is, if it's a cough that is manageable with over-the-counter medicine, okay. So over-the-counter medicine is not that bad. I would never say macam tidak, because for me, even when I cough, I do take that Cak Ibu dan Anak stuff, because the medicine that we have in the hospital is actually cough suppressants. So if there's no difficulty breathing, if it's not really bothering you, and some people now, almost everyone has that oximeter, your oxygen is fine, you're able to eat, you're able to drink, you don't have that high grade temperature, it's fine. But if you have things like, prolonged fever, if you cough and up to the point that you can see like some stains of blood there, or even worse, things like night sweats, maksudnya you're sleeping at night and then you berpeluh so much up until it drenched your clothes. It's not a good sign. Okay, it's a sign of tuberculosis or even lung malignancies. If you're dehydrated, then you should definitely check yourself. And then if you have things like hoarseness of voice, not the raspy voice tapi funny, this is like hoarseness of voice for a long time, it doesn't go away, and there's no sore throat and stuff, you definitely should check, because this could be a sign of lung cancer.
So if
Yeah.
you sound like a rock singer for an extended period of time, you
Yeah.
might need to go get that
Yes.
checked.
Yes. And you have blood.
Doesn't mean you start a new career, huh?
Yeah.
Okay, got
Okay.
it. Okay.
Okay.
Are there any recent advancements or treatments in medical field that's, improve, management of chronic coughs or medication ke?
Okay, I know in like really center of coughs in the US, they do things like actually targeting the nerves that causes you to cough. But this is like really at the end of the road, where we know that this person just have a tendency to cough really bad, and it's not because of cancer, not because of infection, things like that. But in general, it's really, trying to find the cause of it, and then have it control, or stop it, or stop the irritants. um,
Mm,
and,
okay,
that's
got
that's
it.
the best.
What about, okay, one more question with respect to treatment, yeah? Are there any non pharmacological approaches like natural home remedies that's safe and effective? Just wondering, in your experience.
Okay, in my experience, okay, I used to work in a center with a whole group of infectious disease consultants, and they actually advocate hot tea and honey,
Ah,
and yeah, and lemon as well. So
mhm.
it's good. I tried it myself. It's good idea to put that, that lemon stuff. I think it's
Mm.
more of the lemon, because there's this one mak who came to me who said, uh, Doktor, I letak lemon dengan kicap and it
Oh, okay.
worked.
Oh,
I was
and it
like,
worked.
I
Okay.
was like, laugh and laugh and laugh. But so it just goes to show, I think it's the lemon part rather than the honey
Mm,
part. But
mm.
in the Muslims medication, Muslim punya history, we always advocate things like honey. But of course, if you
Yes.
have diabetes, not so much maybe. But I think it's the honey component lah. And then the hot tea just makes you feel better. So that's that lah.
Yeah,
Mm.
it gives that calm, soothing thing, I think.
And
Yeah.
then I think ginger pun ada orang kata juga,
Yes. Uh-huh.
ginger.
Ginger.
This recently I heard, tapi I sendiri tak pernah nampak. It's actually endorsed by KKM. So when it's endorsed by KKM, they actually went through the National Pharmaceutical Regulatory Advisory. They have like a patch that put bunga cengkeh, I think.
Oh, wow. Okay.
So uh, in medical school, I didn't learn about it, but of course, pharmacology is different. It may helps you to breathe better in the same way that Vicks did.
Mm.
Vicks, right? It's a very
Mm.
popular Asian thing to put
Vicks
Vicks.
vapor up.
Yeah,
We cannot
yeah,
live without it. Or Tiger Balm.
yeah.
Right?
As a doctor, we never like advocate that, but it might, when it has been endorsed by NPRA, it meant that there might be a mechanism that it can improve your cough, provided that it's a simple cough. You see, if it's because of something else, probably it's not. Yeah, but
All
it's
right.
not from it's not proven medically. Yeah, but it's endorsed by KKM. So
And we come to our last slide. So at the end of the day, how do we tackle the problem of coughs? How do we prevent it?
yeah.
And when do we seek expert help?
Okay, so it's
Yeah.
just prevention, so
Mm.
masking up, social distancing if you can, and then hand hygiene, because the way is people cough on that table, you touch that table, you touch your nose, and then stop smoking, because by stopping smoking, you can actually improve your lung health, your heart health, and also the possibility of you developing cancer, a lot of cancer, not just lung, colon cancer and things like that. Also
Not
to
just
seek
you,
expert
but your loved ones as well, because they're the ones who are inhaling more and probably dying faster based on results, right?
help. And then people seem to think that smoking outside does the
Uh,
job. No, it doesn't, because you can still smell it. If you can still smell it, for sure that it has already went inside, and also it sticks to your clothes as well. Okay. Another thing, especially in the elderly population, if you're a bit older, is for you to see a doctor and find out the underlying cause. So, as a doctor as well, I have a higher tendency to do X-rays and to take investigations if somebody is a bit older, rather than somebody who is young and fit and suddenly have a bit of cold. So you have to find out the underlying cause. The idea is for us to not miss anything, for example, like TB or cancer, and then to comply to your treatment. For example, if you have an inhaler or you know that you're allergic to this kind of stuff, to avoid it, and then to eat well and exercise. Because if you do both, eat well and exercise, your immunity will become better. So
yeah.
you see that you contract diseases are lower.
So that
Yeah.
means it's about having a healthy lifestyle and taking care of ourselves better, right? So our immunity is higher. Then we're
Yeah.
not susceptible so much to coughs and
Mhm.
whatever
Mhm.
diseases there are, right?
Yeah. Yeah.
Okay. Doc, what about, because from what you shared, a key thing of you finding out what's going on is the history, right? The
Mm-hmm.
patient history. So I guess if we have elderly parents and stuff like that, it would help if we have a document that's shared between siblings of the father's medical or the mother's medical history, the ubat, everything. Does that help?
Yeah. It really helps. So, what I learned from my patients, I have very good parents and also things like that. They have like this WhatsApp group where they say, uh, Nelia's sick diary or Mummy's sick diary. So they will share that. Okay, let's say we have a group of siblings taking care of the mom. Okay, during the day, abang will take care of the mom, and during the night, adik will take care of the mom. So they will just share, okay, this morning, this cough like that, and then muntah ke apa. So that's how they share. And this is where they share the prescriptions, the pictures of the medication. So in case that, the abang in the morning has to go and bring the mummy to the doctor and things like that.
Right. So
So yeah,
that's actually a very good habit to start
yeah,
inculcating in families and loved
yeah,
ones, right? Yeah.
yeah.
Okay.
You can keep it in a Google Drive or things like that. But
Mm.
WhatsApp, really nice lah. You can really keep all this
Yeah,
conversation.
updated and backed it up on Google Drive, right? I think
Yeah,
that's the best thing. Yeah.
yeah.
So at the end of the day, I think, Doc, what do you think is the biggest mistake that people make? And if there's one message that people tuning in can take home, what would it be? So that's two things, I guess.
So sorry. The first
The
is
first,
biggest
what's the
mistake. Is it?
biggest mistake in your experience that people make so that we
Mhm.
know what we can do better? And then what's the one message that you want people to take home from this episode before
Okay,
we go into Q&A?
the biggest mistake is probably waiting for too long before you seek help, because trying not to bother, or trying, some people, they don't seek help because they feel that they are busy, but actually health is wealth, and the sooner that you, if it's more than 2 weeks, just get it checked. Okay, if you're coughing, if you're not productive, might as well you get it checked, and then you get better faster, and you can go back to being productive. So that's probably one of the biggest
So
mistake
when
that
you say waiting too long, how long are we talking about? 2 weeks or one
two
week or
weeks.
one
Yeah.
month?
And to
Two
be
weeks.
honest, I think I'm also,
Guilty.
me of the
I
same
mean,
thing. Yeah.
yeah.
When I was coughing as well. Okay, I had a very bad pneumonia one time, and I was working in a hospital. So of course I'll be, exposed to
Mm.
a lot of bacteria. This was like pre-COVID. It
Mhm.
turns out a very bad pneumonia. I was admitted for a week. So we all think that we can, uh, kononnya tak nak susahkan orang, but in the end, that's not great.
In the end, kita lagi menyusahkan orang,
Yeah,
right?
yes.
Yeah.
So tak
So I
sampai.
think, yeah,
Yes,
I think
yeah,
we need to start thinking of health that way because
yeah,
we don't want to trouble people, but the
yeah,
longer we keep it, the more we're troubling people. So
yes.
let's do, and you know what? Loving ourselves, there's nothing wrong with that. It's good.
Yeah, there's
We're
nothing wrong
teaching
with that.
people good virtues and habits. Okay,
Yeah. But
kind of thing.
doctors are the worst at that. I'm telling you, you're the worst. Doctors makes the worst patients.
Oh yeah,
Uh,
yeah, yeah. You know, my dad's a doctor. He's the worst. He's a patient now. He's the worst. So
I can say
dengarkan
all
doctor.
of it.
Yeah.
Yeah. Okay.
Yeah,
So
if you're watching, make sure you take care of yourself. Okay. Okay.
my message is
Mhm.
probably, okay, if you're well, alhamdulillah. If you're if you're sick, go see a doctor. But my message is probably, okay. So we're in 2023. It's good for you to have a regular health screening. Okay,
Mm.
I would really advocate health screening for everybody. Okay, and if the older you are, the more frequent you should be going. If you're younger, you
How
can
frequent?
probably wait every.
How frequent for if you're older?
Okay, if you're more than 40, maybe you can do every 2 years.
Okay.
Okay, but if you're 60, maybe every year. And
Mhm.
if you are already diagnosed with things like, high blood pressure and cholesterol, maybe every 3 months or every 6 months. Okay,
I see.
but when you go for health screening, it doesn't mean that each time you're gonna have an X-ray done. It could be that each 3 months we're gonna take your blood for cholesterol only, or we're gonna see how your glucose control is seeing. And
Mhm.
then some people think that, okay, I've got high blood pressure, and then I will take this kind of lifestyle modification. For example, I will try to reduce my salt, and I try to lose weight and things like that. But they're not being fair in the sense that they don't check back in 3 months. Is it working or not? So
Mhm.
whatever strategy that you've used, you have to see whether they are effective or not. So my message is, it's not just about coughs, but in general about health. To be a bit more proactive towards your health, because it doesn't matter how much money you have, how much time you have. If you don't have the health, you don't really have anything. Yeah,
Yeah,
you can
which
all
is
the
true.
time. You
All
can
the
have
money
all.
in the world will not make a
Yeah,
difference. Yeah.
yeah. Where else, if you have health, at least you can still spend time with your loved ones, even with less time or maybe a smaller amount of money, you can always. So I would
Okay.
say number yourself. Yep.
All right. So definitely, if there's one message, is get yourself checked every year for anything,
Mhm.
just for regular
Yeah.
maintenance. You send your car for checking every 6 months and or every certain thousand. You should definitely get yourself checked as well. Same, right? Okay.
Yeah.
Well, thank you
Yes.
so much, Doc.
Okay.
Let's go into. I found this really insightful. So
Mhm.
many things could cause you cough, and I guess
Mhm.
it goes back to the basic: get yourself checked. You never know, kind of
Okay.
thing. So let's go to the Q&A right now. We've got one from Anna. Okay. So Anna L. Ching says, what causes a lot of phlegm? How to get rid of it? Okay.
Okay. So, how to get it is actually by coughing. Okay. You can also, there are medications that you can use to actually expectorate or loosen up the mucus or the phlegm. So, what you can do is actually to take medicine. And then sometimes this phlegm, you keep on producing it because there's an infection going on. So
Mm.
another way for you to handle it is to actually to treat it with antibiotics. Usually it's caused by bacteria, especially it's accompanied with high grade fever and things like that. The phlegm is actually your the bacteria causing the phlegm and then creating those kind of phlegm. And I think I saw one of the question kata there's a color of the
Yeah,
phlegm
definitely.
matter. I remember in microbiology class, my microbiologist kata tidak. Because
Mhm.
you can never tell. Okay, so in medicine, there's something called likelihood ratio. How sure are you that this one is bacteria and this one is virus? But usually, if somebody comes with me with a very thick phlegm, um, it's I have to give them antibiotics because the thick phlegms a reaction by the body. It's very usually virus cause much more of a barky or dry cough, but bacteria tends to cause this phlegm. So you can take medication to loosen up the phlegm, and you can also take antibiotics so as to to counter the bacterial infection. That's how you get rid of it.
That's how we counter it. Okay. Got
Yeah.
it. Okay.
Okay.
Next question is from Tenmala. I think this is a bit technical, but I think you're the person to answer this. Hi, doctor. May I ask if IGRA tests indicate to diagnose palm? What is that? Could you share?
Is it PCR or immunology? Okay, so pulmonary TB. Okay, in pulmonary TB, there's two types of pulmonary TB. One is the one affecting lung parenchyma, and another
Mhm.
is the one causing effusions. I think one of the X-rays I shot effusion. So usually TB causes infection at the top of the lungs. Okay, that is like the typical pulmonary TB. So to diagnose a pulmonary TB, if you already have all these chest X-ray finding, you don't need any PCR things and things like that. Usually, how to diagnose it is if you can take a culture and then diagnose it. It can also be from an X-ray or a CT scan, or you can also do a Mento test. You don't really need to do an IGRA test unless it's more like a screening test. Because I think some companies does a blood test to diagnose TB, and that is more like a screening test rather than a confirmatory test. I have
I see.
personally never, because I'm an emergency, I'm not a respiratory physician. I have never come to a situation where I have to request somebody to go through the IGRA test. It could be my bad, but it's not widely done in emergency setting anyway, and in a normal pneumonia anyway.
Okay.
Dharmala, are you listening?
Yeah, I think so. Because
Much,
further down, let us know that answer. Yep. She says,
yeah,
okay, thank you, doctor. Ni mesti student ni, or
yeah.
medical student or nurse. Yeah. Okay. So Suraya has a question. Can children outgrow their asthma?
Yes, definitely. So what happens it's usually is like this. Okay, somebody who is probably born premature or maybe borderline premature, so they have this tendency to develop a lung infection. Okay, so be coming in and out of the hospital, the clinic, and needing the nebulizer. But as they grow stronger, if their lung become more mature, they don't have this asthma anymore. Yes, children can outgrow their asthma. So this is also another reason why the younger child lah, less than 2 year olds especially, but sometimes even less than 5 year olds, kita tak suka nak bagi diagnosis asma tu. Kita tak suka
Mm-hmm.
because sometimes they will aggravate. So we'll just say that, oh, they have infection of the bronchus. We'll say bronchitis. Another thing is just to macam make people more aware of how insurance work.
Mm-hmm.
Okay, I have diagnosed somebody with asthma. Then in the future, that when they apply for an insurance, they might not be covered for it, even though it was just like a transitional thing from childhood to adolescent and that kind of stuff. So we don't simply diagnose somebody with asthma. Yeah,
I
and they
see.
can go.
Okay, okay. Yeah, you're right. I think that's better. What about there are people who they get asthma when they're a kid and then suddenly as an adult it's gone and then does it come do some people
Yes,
it comes back?
yes,
How
it
does
might.
that work? Yeah.
Okay, so it works because the peak of your health is probably between maybe when you're 16 until you're 30,
Okay.
probably
Then
30,
it
30.
goes into
That's when,
declining.
yeah. So
Only
so this
15 years, that's so sad.
that's just on top of my head, when I see them, getting sicker after 30 or 35 or 40 and things like that. So what happened is they're at the prime of their health. So they are not as, sensitive to the dust and things like that. As they grow older, they're more exposed to haze, and then they're probably not eating well,
Mhm.
not
So it's a
keeping,
whole combination.
yeah.
Okay.
So it comes back. Yeah.
Okay,
So
that makes sense. Okay,
yeah.
one last question before the quiz. Okay, this one
Mhm.
panjang skip. Let me see.
Mhm.
This is from Yvonne Chang. I
Mhm.
developed into having sinus as diagnosed by ENT. I saw after post-COVID 7 months. After 7 months, I still like having flu symptoms. I had COVID in November 21. Diagnosed of having sinus when I saw ENT on July 22. After 2 months,
Mhm.
I was better, and this year in August, I lost sense of smell, no COVID. I went back to see my ENT as advised by my pharmacist, and he said I had sinus again and prescribed antibiotics and nasal spray for 1 week. And then after nasal spray with steroid for a month, now every morning I will have okay, yang ni,
Twin?
there's no
That
information.
nasal
Okay,
spray, is it?
I think so. With steroid for a month. Okay, let me see if
Now every morning I have to use that nasal spray, I think, is it?
yeah. Oh wait, okay. Now I get it. I have to go to Facebook. Kejap, eh. Now, every morning I will have to blow and cough upon waking up. I went through a clinical trial for tiger mushroom tablet at UM since 510. Lung x ray and lung function test is normal. Is it advisable to have a CT scan of my lung if I still cough occasionally?
Mm,
Don't you think?
okay, so I don't like to give advice for people that I don't examine myself. And to
Mm,
say that somebody needs a CT scan is something like a huge thing, okay, because it involves you going through radiation. So UM is a good tertiary center. To be honest, I was previously from UM. So the best person for you to get to ask is actually the doctor that endorsed you in the trial. Okay.
mm.
I
Okay.
wouldn't be able to say from here. If you need it, you need it, and the types of CT scan that you need for lungs is a bit different. Maybe what you need is a CT scan of your sinuses.
Okay.
This is not your
Alternatively, you can
Hmm.
go over to Bukit Rimau and see Dr. Nabeela. How's
Yeah.
that?
So okay, if it's nose, we have ENT doctors. We have two very seasoned ENT doctors. I'll be happy to directly towards them. We also have a respiratory physician, a visiting physician for lungs as well, Dr. Vijayan. So by
Okay.
all means, I'll see you.
You're very taken care of. So do have a chat with Dr. Nabila. Let's go to the quiz, shall we? Can we have the quiz slides? So it's time for the quiz. And as mentioned at the earlier part of the show, we've got some towels out for grabs. But what do you need to do to win? First, you got to be sure to share this video out at least 3 times. And remember to set the share post to public so that everybody can see it. Next, answer the 3 questions that we're going to show on the screen in a single comment. You're on your way to win the prizes. Let me repeat that. First, share the video out 3 times. Remember to set the post to public so everyone can see. Secondly, answer the 3 questions that we will show on the screen in a single comment, and we will select the first 3 winners based on the correct answers and shared posts. All right. So if you are ready, let's take a look at the question. Number 1, cough is a protective mechanism to clear out pimples. Is that true or false? Cough is a protective mechanism to clear up pimples. True or false? Number two, avoid wearing a mask. Smoking and hand hygiene can help us prevent coughs. True or false? Avoiding wearing a mask, smoking, and hand hygiene can help us prevent coughs. True or false? Question number three, getting hungry frequently and putting on weight are both huge indications of when you need to seek treatment from a doctor for your cough. Getting hungry frequently and putting on weight are both huge indications of when you need to seek treatment from a doctor for your cough. Be sure to write your answers in a single comment. All right. We're going to go back to the Q&A. Okay. Our next question is from Ara Devan Haran. Hi, doctor. Is asthma hereditary? Thank you.
Okay. To some extent, okay. Tak semestinya you will for sure will get asthma if your mom or your dad has asthma, but it is definitely hereditary. There has a genetic predisposition for it. Okay, but not
Not
semestinya.
necessarily.
It's not like a dominant genetic thing where you will have, some things are like that, like the
Mhm.
here and things like that, but not asthma. But a
All
higher
right.
tendency is, yeah.
All right. Next question is from Cecilia. Hi, doctor. I have a question. I had a cold before, and when I went to see a doctor, he prescribed me medication for the cold only because I didn't have cough at that time. So no cough medicine is given. However, after taking the medicine, my cold improved, but cough started. The cough has been getting worse, and the cold has come back. So should I have taken cough medicine from the beginning, even if I didn't have cough initially?
No. I think what happened was probably that you had a cold and then you didn't have a cough at that time, because the cough doesn't settle the problem. You see, it's not like if you have taken the cough medicine earlier, it will come back. The cough medicine that you take for that time only suppresses the cough at that time. So if you
I
didn't,
see.
yeah, because it's just a cough suppressant. Maybe if you're asking about things like antibiotics, maybe it's different, but you couldn't prevent a cough from coming if it was about to come by taking a medication when you don't have cough.
Okay, got it. Next question is from Cecilia again. What are the differences between dry cough and wet cough? I think it's a great question because I also don't know.
Okay, so a dry cough is a cough without phlegm. So you just cough, 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 and it feels very, very parade lah. So this cough or wet cough is something that we call productive coughs. You cough, you actually produce sputum or phlegm. So that's the difference. Mhm.
Okay, got it. That's very simple to distinguish.
Mhm.
Suraya has a question. Does honey, water, and ginger, etc., really help with cough? I think you answered it, but for the purpose
Yeah,
of people who are
yeah.
tuning in, yeah,
Yes, please do. But as of with anything, don't go overboard lah. Take it once or twice a day. Don't have like whole
overdo it.
jug. Yeah, yeah.
That sounds like what I would do. Sorry.
But
Okay.
people do like ginger shots now.
Is that
Plus,
good? That's okay.
I think it's okay. Sounds okay. Sounds very okay. But whether it will like resolve your cough, I'm not sure. But it sounds like it is healthy. Okay, so it might work for you depending on the cause of cough. You see.
I see.
Okay.
Okay. Got it. Our next question is from Suraya. This is about whooping coughs. How contagious is it?
Okay. It is quite contagious, but the how contagious it depends on whether you were vaccinated before or not, and how much exposure you got. Okay, but
Okay.
definitely it's
But-
contagious. Yeah, it spreads the same way as influenza and the same way as COVID.
Okay. So
Basically,
it's very contagious then,
it
if
is
that's.
contagious.
Espian's question is, Hi, doc. If someone is suffering from long term cough, what should we do? Go for x ray? I think this is great to sum up everything. So, what should they do if you have long term
Okay,
cough? And definition of long term cough is more than 2 weeks, right?
2 weeks. Yeah, if you
Okay.
have a long term cough, you should. I wouldn't say go for X-ray, because if people go for X-ray, they just say I want an X-ray. What you should do is you should see a doctor. So the doctor will take a history and then say, okay, the doctor will be able to find out you ada gastroesophageal reflux ke, postnasal drip ke, asthma ke, apa ke. The doctor may or may not need you to do an X-ray. So of course, X-ray is one of the first line investigations for long-term cough. But I wouldn't say that what you should do is go for X-ray. I think I would say go see a doctor and get the advice first. And the doctor may say that you need an X-ray.
Okay, because not necessary everything
Yeah,
is
great lah. Nanti macam you pergi, it'll be like tak indicated pun tapi you buat. So
okay.
it's a waste of resource and it expose you to radiation.
All right. So this is the question from the before. Does the color of phlegm mean anything? That one you answered already, so no problem.
Mhm.
All right. Question from Ara Devaharan. Hi, Dr. Nabila. I saw one video about cough and flu. It says during the first week of dry cough, avoid taking cough medication. Take antihistamine instead. Is this true? Please explain.
Okay, actually, some of the cough medication has antihistamines with it. If you take antihistamines, your cough will be settled in a certain extent. But to say that don't take cough medication, it's not really a rule. It's probably a tip from a doctor who feels that most of his patient works that way. But it's not like a rule, a steadfast rule. But taking antihistamine does improve cough.
Taking
Yeah.
antihistamines, but it's not a hard and fast rule. Okay, got it. So if you
Yeah.
have any questions, please let us know in the comment, kind of thing. But apart from that, yeah, doc, if there's anything else that you want people to take home, what are some things that they can do, which are good examples that your patients do that you can share with our
Okay.
audience today?
Take home. Okay, when people are talking about antihistamines, I hope that when they take their medication, if they buy their over-the-counter medication, they actually know the active ingredient of it, because some of the medication are of different bands, tapi the active ingredient is the same, so you ended up overdosing. So
Right. Okay.
yeah, yeah. So macam lebih baik, macam sometimes orang kata I take this apa Euphamol, then I take this Actifast, but actually it's the same thing. Macam tu lah. So it's, if you are taking over the counter medication, you have to go a bit. You have to have the initiative to find out what is the active ingredient within that medication. It's not wrong. Of course, you can buy over the counter. Just show that you know that what are the activities so that you can avoid overdosing yourself.
Right. Okay. That which is a very important one. Thank you so much, yeah, Doc, for the sharing. That is really really informative because we're trying to do everything and then tengok teroverdose kan.
Overdose. Sebenarnya ubat
Sebab
yang
itu
sama. Ya,
itulah.
sebab ada
Ya.
setengah ubat tu, contohnya Panadol, ada yang sambung dengan ubat yang berhentikan bersin. Ada ubat Phenylephrine.
Okay.
So you just have to turn the back of it and you can see. You can see
Okay,
that.
okay. That's a
Yeah.
very good tip. So I hope you take that for note. And we have our winners for the quiz, by the way. So we have our winners, but before we announce who our winners are, let's find out what the correct answers to the questions, shall we? So so Doc, if you can help me by reading out the answers, right? Let's take a look. Okay, so the first question is cough is a protective mechanism to clear out pimples. True or false? Tak
False.
dengar tu. False. Yeah, it's not about pimples. It's to
Okay.
clear, right? Okay. Question number two: avoiding wearing a mask, smoking, and hand hygiene can help us prevent coughs. True or false, Doc?
False. Please wear a mask. Please don't smoke. And please wash your hands.
Okay, keep up your hygiene. Getting
Mm.
hungry frequently and putting on weight are both huge indications of when you need to seek treatment from a doctor for your cough. Is that true or false?
False. But you do
False.
have to do something about that.
Definitely. It might not be related to cough, but it's definitely something to look into. Thank you for pointing that out. So the correct answers are false, false, false. All right. So the winners of the quiz are Cecilia Chong, SP Yan, and Jacqueline Jancy Jimin. Congratulations. All right. So don't go anywhere. Please make sure you check your messenger because we'll be contacting you on how you can get your prizes, which is a towel. So congratulations to our winner. Thank you so much, Doc. Thank you so much to our audience as well for all your questions. And indeed, today was an insightful session. What was your biggest learning? Let us know in the comment section. For me, it's definitely check your meds, have a good record when you go so that you can update the doc and stuff like that. And a cough certainly might not have anything to do with common cold. It's important to find out what the underlying cause is so that we can get the right treatment for you. All right. Thank you so much. Thank you again, Doc, for this super
Mhm.
insightful session.
Okay, thank you.
All right.
Bye.
So thank you. We'll see you guys soon. In the meantime, if you want to share this video out, please feel free to do so because you never know who you're going to make a difference to. I'm Nina Sharil Khan signing off. Thank you and goodbye.
Bye.